My name is Dolly Wilson, and I'm patient navigator, and I'm also a community educator. The unemployment rate in Burke County is higher than most counties, and even though the state level has gone lower, the Burke County rate has gone higher recently, and therefore there are numerous people that have no income for health care, no insurance, and therefore Jan is my go-to person when I need things for patients, and the needs are great. Treatment for cancer, as anyone knows, is very, very expensive. You know, especially if they don't have insurance, they can't even get the preventative treatment of a mammogram. When we run out of the money from the Komen funds, the foundation comes to our rescue, and they've got grants that they've received to help pay for the patients' mammograms. And then sometimes we get the point of the patient, okay, we've got a suspicious mammogram, what do we do? And then we go back again and we see if we can give this patient money for the diagnostic, which we're able to do also. And then of course along the treatment span, first of all, after surgery, they need a post-surgical camisole, bras. If the patients don't have insurance, what do? Once again, this is a very, very expensive garment that the patients need for comfort, for the drain bags that they have after the surgery. And then they also help pay for the different educational products, such as the breast cancer treatment handbook. That book alone is to about $20 or more each. The needs of wigs, if they have to have chemotherapy because they're going to lose their hair, or things such as the hats and then the turbans. And the best feeling was, I can remember a particular situation where a patient came in and she'd been very depressed through her whole treatment. And at the point of healing, she needed prosthesis. Well, once again, if anyone's ever bought a prosthesis, they're about $300 to $500 a piece. So once again, because of the grants from our foundation, I fitted this lady with a couple prostheses because she had bilateral mastectomy and a bra, and she smiled. And she says, you know, this is the first time that I've smiled through my whole treatment. And then, of course, some of the other things that we get for our social worker, we have patients who don't even have gas money because radiation treatment entails sometimes 20, sometimes 38 visits. And as you know, especially if you're farther away from Valdez Cancer Center, then the gas can get quite expensive. So we have the patient go to Tiffany to see if we can get gas cards. And then we get to the point of medication. Now what do we do? We don't have insurance. And again, thanks to our foundation's grants, then we're able to help patients with medications also. The most wonderful feeling, of course, is at the end of all this, we see a patient who's had their needs met and they've completed treatment, and most of our patients, of course, achieve not particularly a cure, but a remission from cancer. So thanks to our foundation, many of these needs we're able to meet them. I'm very uncomfortable with going up to people and saying, can you donate money to me? But this need is right at the patient's barest need. I mean, gas, medication. We've even helped patients with food cards. We try to perceive that need, and we'll ask them, and we're just amazed when even people who are working sometimes have low incomes and children, and so we've even been able to get money for childcare, which was really, really exciting. When we've had patients actually with 4 and 5 children and young children, and so Jen, having a lot of experience with working in the cancer center and working with the needs, said, well, we'll try to get a grant for childcare, and we've actually been able to get grants to help with childcare for patients. We appreciate the support, and I would like to thank Blue Ridge HealthCare Foundation for the monies that they've helped provide for our patients. And I wish that each of you could at least have a glimpse of the expressions on patients' faces when we're able to provide them with a wig or even a hat or or especially the prosthesis and camisoles and bras, because it's hard enough, you know, that it affects their self-image. And what we do is we try to be the rescue source to say, you know, we're here for you. And the Blue Ridge HealthCare Foundation, I don't know what I'd do without them.